Of note, scammers use PACT Act to target innocent veterans. According to the Veterans Benefits Administration, the Honoring Our Promise to Address Comprehensive Toxics Act of 2022, PACT Act, will be the largest expansion of veterans' benefits in history. Predatory individuals and companies, real or fictitious, are taking advantage of new opportunities to commit fraud with an increase in PACT Act-related phishing, email, vishing, phone, and social media scams targeting veterans to access their PACT Act benefits or submit claims on their behalf. Multiple veterans are known to have been contacted by such parties during the past 60 days through cold calls, emails, or text messages. VA was recently notified about law firms targeting veterans who were stationed at Camp Lejeune. The firms are pressuring veterans to sign contracts allowing the attorneys to represent them in federal lawsuits. Contact information for the veterans is likely obtained through the Camp Lejeune Registry or other public registries. Aggressive tactics used include emails outlining a sense of urgency and the need to act immediately, advertising for lawsuit support with no initial fees unless the suit is won, amplification of false information about the Camp Lejeune crisis on social media and television, asking veterans to sign contracts requiring access to medical records and demanding a large percentage of the total amount recovered for veterans. VBA has launched a communications campaign to spread awareness of PACT Act best practices, fraud tactics, and prevention strategies. The specifics and most recent information are available at VBA's social media profiles, Facebook, Twitter, Instagram, and YouTube. They include the following tips. Do not provide personal, benefits, medical, or financial details online or over the phone. Federal agencies will not contact you unless you make a request. Do not click online ads or engage with social media that appears suspicious. Check for https:// at the start of all website addresses. Enable multi-factor authentication on all accounts. Work with veteran service providers you already know, such as the BVA Veteran Service Program. Report any suspected fraud to reportfraud.ftc.gov, VA OIG hotline at va.gov, or call 800-488-8244. Process simplified for medical debt relief. In early March 2022, the White House announced an effort toward reducing financial hardship for veterans by simplifying the process by which they can apply for medical debt relief. 3 months later, the Veterans Health Administration launched a simplified application process allowing easier access to the debt relief veterans may need. The process was supplemented by an online application option last month at https://www.va.gov/manage-va-debt. Veterans may still apply for medical debt relief in their local facility's revenue office or by calling the Health Resource Center at 866-400-1238, Monday through Friday, 8 a.m. to 8 p.m. Eastern Time. A VA Form 5655 must still be used to apply for medical debt relief no matter which application method is used. The form is available online and at VA facility revenue offices. Patient statements are mailed monthly but can also be accessed online via https://www.va.gov/manage-va-debt. AI lends new insight into traumatic brain injury. Newfound artificial intelligence, AI, models are now providing federal agencies with the means to apply a range of data inputs to better understand the origins of traumatic brain injuries, TBIs, and how to help patients recover from their long-term impacts. Speaking at the 2022 Brain Summit, VA representatives outlined how cutting-edge technologies such as AI and machine learning are providing newfound insight into neurological injury. TBI is a hallmark battlefield injury of America's post-9/11 conflicts, since enemy combatants have made extensive use of improvised explosives that inflict a high rate of cranial damage. In the early 2000s, TBI was also linked to effects on the optic nerve. Finding ways to better understand and treat TBI has become a priority for VA researchers and the Department of Defense, DoD, especially since the condition manifests an array of symptoms that can vary considerably and often overlap with other conditions such as psychological trauma and vision loss. The efforts are still in their infancy and currently undergoing significant expansion in both outside collaboration and sophistication. One of the more promising studies, the LIMBIC phenotype study, links DoD combat theater and health systems data with VA health system data to identify risk factors and create more personalized forms of treatment for veterans living with TBI. The goal of this study is to provide a foundation for AI, said VA research scientist Mary Jo Pugh. It's a longitudinal study that links DoD and VA data for more than 2.5 million post-9/11 veterans. Data sources of healthcare and patient history will be merged into machine learning models that will hopefully shed greater light into the nature of TBI and its relationship to both physical and mental health conditions. New VA grant funding to help homeless veterans. VA has awarded $137 million in grants through its Supportive Service for Veterans Families (SSVF) program to help veterans and their families who are homeless or at risk of becoming homeless. The new grant awards, announced on September 13, supplement the previous fiscal year 2022 SFVF grants, increase the number of veterans who are eligible for SFVF assistance, and allow 150 nonprofit organization grantees to expand on existing services for veterans and their families. VA has placed more than 22,000 homeless veterans into permanent housing in 2022. The goal for the year is 38,000 permanent housing placements. It's our goal to remove the barriers that stand between homeless veterans and the home they need and deserve, including rental costs, cumbersome rental processes, and more, said VA Secretary Dennis McDonough. These grant funds will empower our Trust VA partners to help homeless and at-risk veterans through the entire housing process, from identifying a home to affording it to making it their own. During FY 2021, SFVF served 114,175 participants, including 80,049 veterans and 19,266 children. Father Carroll biography now in talking book format. Caution: Blind Priest Driving. The Story of Father Thomas Carroll, Changing the Public's Perception of Blindness, by Rachel Ethier Rosenbaum, has recently become available to BVA members and their families via Braille and Audio Reading Download, BARD, a service of the National Library Service, NLS, for the blind and print disabled. Father Carroll served as BVA's first national chaplain from 1946 until his untimely death in 1971. He was a pioneer in the field of blind rehabilitation and instrumental in the inauguration of the Hines Blind Center in 1948. He is one of only 32 members of the American Printing House for the Blind Hall of Fame. Notwithstanding the humorous title of the book, Father Carroll was not blind himself. In BVA circles, he was known for stirring speeches and frequent counseling sessions, utilizing both his professional training and innate sensitivity in assisting blinded veterans to understand their potential for productive and meaningful lives. Chapter 6 of the book, entitled The Birth of the Blinded Veterans Association and Hines Hospital, further reveals the important role BVA played in Father Carroll's life. Despite knowing Father Carroll personally and with special access to his writings through her 33 years as executive director of the Carroll Center for the Blind, Rosenbaum researched his life for more than 8 years. In 2014, she attended the BVA 69th National Convention in Reno, Nevada, to interview BVA members who had met Father Carroll personally. NLS and its resources fall under the jurisdiction of the Library of Congress. It is a free Braille and talking book library service for people with temporary or permanent low vision, blindness, or a physical, perceptual, or reading disability that prevents them from using regular print materials. Through a national network of cooperating libraries, NLS circulates books and magazines in Braille or audio formats that are instantly downloadable to a personal device or delivered by mail free of charge. charge. To access the book or for more information on how to qualify for BARD services, visit https://nlsbard/login/NLS. Military Hymn Download available for Veterans Day. Planners for the services, ceremonies, and observances of Veterans Day this year have a new resource to consider, a military hymn entitled Ever Faithful to the Call. The hymn can be reviewed and downloaded free for nonprofit or personal use at www.everfaithfultothecall.com. Composer Tom Lau turned to chaplains, veterans, family members, widows, and church music professionals for their ideas and suggestions in the hymn's development. Field testing of the hymn in late 2021 provided additional feedback for the final revisions. Lau invites military units, religious denominations, and civic organizations to consider incorporating it into their Veterans Day observances. The 4 verses of the hymn were sung recently as part of an organ recital at the West Point Cadet Chapel at the United States Military Academy. I feel that this hymn has the potential for widespread use in military and civilian settings for Veterans Day and other occasions as well, said Craig Williams, West Point Chapel organist.